Doctor, in our series today, I'm here to present farmers' questions, yes, to you. And this time around, the most asked question is, how do we deal with the coryza?
Infectious coryza.
Infectious coryza. It is more in farms there. So people are asking, how do we treat signs to know that this is infectious coryza and everything. So
okay,
that is the most asked question this time around.
Okay.
Yes.
They want to know more about infectious coryza.
Yes, infectious coryza.
Hello, welcome to MS Veterinary Center. Today I've hosted one of my greatest farmers, so stay tuned.
Yes, doctor.
Yes, please.
I'm back with our Ask Your Vet.
Okay.
And this time around, I'm here to present farmers' questions.
Okay, you're most welcome, please.
Thank you.
To MS Veterinary Center.
Okay.
Where we offer dedicated expert care for all your animals' needs.
So these people should expect to be answered their questions.
Yeah, by the way, we are here to help farmers help themselves. You can come in here.
Okay, doctor.
Yeah, you're most welcome.
Okay.
Glad to see you here.
Okay.
You can take this attire.
I can put on this attire.
Yeah.
Farmers, you see, I'm changing. At least this time around, I'm to resemble as a doctor.
By the way, it has fit you just the way, as if.
And you see,
MS Veterinary
Services.
Yeah.
These people are mistaking. I've realized some are mistaking infectious coryza with the fowlpox.
Yeah.
So you'll be telling us at what age, what everything. These people want to know.
Okay, our viewers, I've got that you need to know more about infectious coryza and then fowlpox. But let's go one by one.
Yes.
First of all, let's deal with infectious coryza.
Infectious coryza,
yeah.
Yes.
Infectious coryza is a bacterial disease which is caused by a bacterium called Haemophilus gallinarum. And this disease is affecting majorly not the younger chicks. Those ones are excluded. It is from a later stage where they keep attacking to adults.
Yes.
That is when they do what? Attack these birds. And now a farmer may need to know, how do these birds get these diseases?
Yes.
That is the transmission, the mode of transmission of disease from one place or from one bird to another.
Yes.
First of all is direct contact with a susceptible bird, where the infected bird gets into contact with the what? With a susceptible bird.
Yes.
There it can contract the disease. And it is also airborne, whereby it can be transmitted through air. And also, when a susceptible bird gets into contact with the nasal exudate, it can still contract the disease.
Okay.
Yeah, and now another question may come in. How can a farmer detect that this is what? Infectious coryza.
Yes.
First of all, in the initial stages, you can see the bird half closing the eye, or completely closing it. Then the bird becomes depressed.
Yes.
Then you can still, it can develop to form an edematous swelling
Of the eye. Yes.
Yeah, and now at that stage, the disease shows that it has matured. So it develops inside there. There is a stuff which develops in there. It is sometimes yellow to white.
In the eye.
In the eye.
Yes.
And now the farmer will wish to know, how can this be removed? do we treat it just, for example, that one which has that stuff which develops within the eye? Do we remove it, or we put eye drop, or we treat how?
Yeah.
Now,
yeah, doctor, on that point, you're trying to mean that is it the first stage where we see those particles in the eyes, middle stage, or the last stage of the disease?
No, that one is in the last stage of the disease.
Yes.
This tearing and the initial depression, then lack of appetite. The bird develops a tendency of not feeding well.
Not feeding well.
Yeah, so when the thing keeps on maturing,
yes,
of course there will be a decrease in egg production because it is not feeding well because of the disease. So there will be still a reduction in egg production, and those exudates, as those exudates are inside.
Okay, you're trying to mean these are the general signs.
Yeah, the general sign is
everyone can detect that maybe my dad is getting sick. Then the other signs we've been talking about, swelling the eye, tearing. Then it means you are attacked by infectious coryza.
Yeah, infectious coryza.
Okay, doctor.
And I wanted to show them how, to let them know how should we deal with that bird whose eye is already edematous and has a staph inside the what? Inside the eye. There, it is important you get a piece of cloth which is clean. Then you get warm water. You get that bird, you put it on a clean floor where you can put something, then you can squeeze that eye, that stuff will come out. Okay. And after that stuff coming out, make sure that you view inside whether it is fully removed. And if it is not fully removed, you make sure that you remove even the remaining stuff. Yes. And after, you can pour in an eye drop. Like you can drop in some tetracycline. Yeah, then in that, on top of that one, you can bring in some oral drugs.
Okay, doctor, as you said, yeah, this is the one of the last stages, last signs, or what we can call secondary signs. But there is that farmer who will detect this infectious coryza before that stage, maybe at these first stages where there is that tearing. Tell us how to deal with it if it happens we find it at that stage.
Yeah, when it is at that stage, it is important for a farmer to begin on oral drugs, like drugs which can be put in water.
Yes. And
then you can also make some ointments onto that eye.
Yes.
For example, the oral drugs, you can have this one. They are important.
Okay.
You have this one. You can work. They can help us.
Okay. Yeah, this time around we got a chance. We are inside the water, so where there is everything. So these people let us get a look at this.
When you chance to get these ones, you can easily help your birds cure. So long as you detect. And by the way, it is very important to make sure that you see them before they sleep, just for the purpose of determining the general health
of the
birds. Because if you do not, they will undergo and become severe before you detect. So it is very important to keep a keen eye on the status, especially the health status of your bird before it goes to sleep. So when you detect early, you can use these drugs, and still they can use herbal medicine.
Okay, that was my next question, doctor.
Okay.
These people want also to know because others they've been asking how to deal with it, how to treat. They can also be treating using these herbal medicines, or they have to settle only on these medications you've been telling us.
No, there is what we call ethnopharmacology, where we use herbs to treat diseases.
Yes.
And here I have some of the herbs. They are here.
Okay.
This is called ginger.
Yeah, this is ginger.
This is ginger.
Yeah.
Then there is also this one.
This is ginger.
That is ginger.
Then this is doctor. This is garlic.
This is garlic.
Okay.
Yeah. And now these ones, when you want to treat your birds, and majorly these ones we use them in preventive measures.
These herbals.
Yes. We usually, and by the way, for me, I normally use these herbals to treat my birds, as you see them.
Yes. Yes.
For me, I don't wait for birds to suffer or to become infected before I do treat them.
Yes.
For me, I normally put these herbals into their drinkers, so they keep drinking once in a while. Like they can take 5 days on herbals, then I withdraw for a period of the week, then they still come back on it. So I end up selling them at their maturity age without them getting what? Diseased or infected.
Okay.
So
which means you're trying to tell us, Dr. Vati, these herbals are very good or very effective at a preventive stage.
Really, that is it.
We don't wait our birds to get sick before
we apply them.
Yes.
Yeah, and by the way, these have been just samples, but there are also some other trees which I normally use.
Okay,
like,
tell us the whole thing. In addition to this is ginger, this is garlic.
Yeah.
What can we add there?
We can add here aloe vera.
Aloe vera.
Then neem tree. Name it, but I will tell you more so long as you contact.
How about moringa, doctor?
Moringa, also those leaves, you crush them, then you get a full concoction.
Yes.
Which you can give to your birds, and they become very much immunized.
Okay.
They build their immunity from those herbs.
Doctors, I mix this. Remember, there is that stage you told us that there is that particle in the eyes. The eyes have swollen. There is that particle. We've tried to remove it. Can I use even this mixed thing maybe to apply there on the eye, or?
No, for this one, you may not apply it onto the eye, but as I told you that at that stage, it's important to use this one. And now this one, we use it for 3 to 5 days. Okay. Then when you see that the disease has persisted,
yes,
you continue with the herbals, so long as those days have already elapsed.
Okay.
You
keep 3 to 5 days.
Yes.
Okay, doctor, there's that one person out there, they are seeing fine these medicines, but you can be telling us the names. Maybe if they are out there, they can go to the drug shop there to look for these medicines. And if it happens they are more there, you'll be also telling us, you show us.
If they wanted to know the names,
yes,
because now there are different companies which are producing these drugs,
yes,
and there are different trade names,
yes,
which are put on these drugs. So what I could easily tell them is the active ingredient within these medications or these drugs.
Yes, yes.
For example, this one is doxetyl. It is an antibiotic.
Yes.
Yeah, it contains tyrosine and doxycycline. So the doxycycline and tyrosine can help. So this is a mixture of 2 active ingredients. Then this one is trimoxazole by the trade name. But what is inside is trimethoprim and then sulfamethoxazole. So that is very important. So what is important is to know that sulfur drugs,
Yes.
then tyrosine, tetracycline,
Yes.
erythromycin.
Yes.
So those are the drugs they need to be put in what? In the drinking water.
Okay.
And they should keep a keen eye on the dosage, because overdose and underdose are both poisonous.
Okay. You've talked about the overdose and underdose.
Yeah.
This is very important, what I know. Because there is a situation where you find someone is using the corrected drugs, but again the disease is persisting.
Yeah, that one normally comes when the farmer has used an underdose of the drug.
Okay.
So this bacteria would build a coat on them, resisting the what? The drug.
Okay.
And this brings about drug resistance. So it is very bad to make an underdose.
Which means we have to follow the instructions.
The instruction is the manufacturer's instructions must be followed.
Okay.
So as to keep up.
Okay, on this same point, doctor, there are some other signs still they are confusing when it comes to this disease, because this disease is very dangerous and
Infectious coryza.
Yeah, it is affecting very many farmers there. That's why I decided to bring out forward that question to you so that you can explain more to my fellow farmers. You find that these birds are having cough, at the same time they are having flu. Then
With cough,
yes,
it is like a common agent. Most of the diseases can also come up with cough. So what farmers must only know is that cough is a common symptom of many diseases.
Yes.
So you should just find out what has caused the cough.
yes,
That is the major point. Because you don't have to treat cough or flu. There is a hidden agent which causes that. So that is just a supplement, because the major sign which you can easily see it to differentiate that this is a disease, this or the other one has not maybe yet what exposed out. So you can be seeing this cough. So you don't treat a cough, but you need to find out
what is causing.
If you cannot find out, then you call a vet. A vet will be able to assess and diagnose your bird and tell you what you're supposed to do.
Which means that is very important. And farmers out there, I think you're listening. Let us be playing our work, or let us be playing our side, and we let the side for these vets also we let these vets also to play their work. If you find your bird is not feeling well, it is very important to report to a vet to know what is causing this. For you will be there seeing cough and flu again, yet there is that one disease that is causing that cough and flu. Okay. Doctor, you've talked almost everything. We've seen the signs, symptoms, treating. Now, I want that one farmer who forwarded this question to know, is it there a kind of management we have to manage our birds in order to prevent this disease, or what is it? Let us see.
Yeah, before we tackle the management section,
yes,
I would like to tell you, because you say that you have tackled almost everything. Yes. I would like to tell you that there is a lot of biology which I have left, but still a farmer can easily contact me. We talk. Yeah, so let's go to the management as you wanted to know. And in the management of infectious coryza, it is important to vaccinate birds. So in most of the developing countries, these vaccines are not yet there. But with the new advances, these vaccines are ongoing. So we can vaccinate our birds against infectious coryza.
Yes.
And still, when you vaccinate them, you have to maintain a good biosecurity.
That is very important.
And this is the most important, whereby you need to maintain sanitation and hygiene. You disinfect the utensils like the drinkers, the feeders. Even at the entrance, you have to put a foot bath where you pour a disinfectant to protect the inner part from contracting diseases from the intruders or the farmers who visit your farm. Because a farmer can move from farm to farm seeking for knowledge and information and new ideas, and in that process could carry these agents, these bacteria. So it is important for a farmer have a foot bath at the entrance, gumboots and overall, so that if a new farmer comes, we'll have to wear those gadgets, enter the foot bath. These bacteria can be killed before entering your farm, so that you can share the ideas. You know, farming is majorly in the form of sharing. You may be having a new idea, the other farmer is having a new idea. So when you come together, you can easily do what? Grow up, because you share. You know, together we develop.
Okay, I'm very happy, Doctor. For answering my fellow farmers, and at least we've known something about this infectious coryza. What I know, we have to go about it. But before anything, Doctor, you can be telling more about MS Vet Center, your contacts, because people are there always asking me your contacts, how to,
MS Veterinary Center is here. This is MS Veterinary Drug Shop, where we base to give veterinary services to all people around the globe.
Okay.
So for us, you can find us on Facebook, YouTube, TikTok, and the contact is 0755 02 55 99.
Will you repeat?
0755 02 55 99. When you pass through that contact, whether you WhatsApp, whether you call, I can easily receive it. So you can easily get me from there. We share. You know me, I love interacting with farmers, because sometimes they tend also to give in some good ideas which us vets need to acquire. So I love them just like the way they do love me. And you know, our work is most of it, each of us love each other, because a farmer cannot live without a vet, and a vet cannot live without the farmer. So we are coincident.
Okay. Thanks, Doctor, for having me and for answering my fellow farmers. It was Ask Your Vet. You know very well this series on our YouTube channel, Mosaic Chicks YouTube channel, and also MS Veterinary Center. You can check out. You can check out all these YouTube channels. You will be finding out this series. Just to know more are to come. I'll be once in a while come through. I present your questions to our vet, and he answers.
So and now we need to answer the second question you asked, which was about fowlpox.
Guys, be tuned. Find it in our next episode.